In the wrong time.
Oh, you know, there is so much going on in our heads about healthcare right now. And this is a good time, I think, to sit down and have a real conversation about what's happening. We've invited Dr. John Osborne, a world-renowned cardiologist here in Dallas, specifically Grapevine, to talk to us about this. And I've got to ask you up front, how have you figured it out? I mean, 15,000 pages. Were you asked to tell us, to explain it? And if so, who taught you?
Well, you know, even our representatives were told, pass the bill, then we'll learn about it.
I know.
So, like most things, it's on-the-job training. So, you know, we were given this, and we figured it out from that point.
Who is we?
Well, I mean, physicians are very interested in all this, but even then, a lot of physicians still don't know a lot of the details.
So, in other words, Washington didn't come give you an...
There's no formal training.
Okay, good.
There's no formal training.
And I like that, because you sat down, and what we're going to talk about today, and I know that Lisa wants to talk about, are some talking points about this thing that we're going to be, that's going to overtake us, and we don't know if it's going to be worth a whip.
Yes, it is overwhelming. So
It is.
if you don't mind, let's just first of all break down in layman's terms what Obamacare means for everyone, for our viewers, for us. How is it going to change the way we see healthcare?
I think it's segmented. So if you look at sort of medical insurance guaranteed by the government, that's Medicare. And when you have Medicaid for those that are disabled and the poor. So we have programs where we have the issue is the people in the middle, where insurance is provided by employers, which is great if you have a job and a job that provides insurance. But of course that translates to 42 million people that either don't have jobs, unemployed, or have employers that don't provide insurance. That's 42 million, and 6.3 million people in Texas do not have insurance.
So how are those people helped?
So what happens is...
How, let me ask this. I want to know how they're helped, because I get it. They get insurance. But there's so much taken away from those of us who have it.
The reality of this is it costs money. So what this probably will be the largest ever redistribution of wealth from the older individuals, Medicare, where we're cutting that budget by $700 billion to pay for the uninsured.
And yesterday I had lunch with my ex-husband, Ken Humphreys, who is on Medicare. He had 4 doctors that have all dismissed him because they're no longer doing Medicare patients. And this is what's happening.
Here's the evolution of what will happen. At the primary care level, you go to see your primary care doctor, whom we've seen for years, and they say, we don't take Medicare anymore. At the specialist level, specialists tend to take care of a little bit older population, cardiologists and gastroenterologists and all of those specialists. Well, we're now beginning to see the specialists begin to say, I don't take Medicare. When the specialists don't take Medicare, which is a large proportion of their population, you know that
And they don't take they won't take Medicare because they won't get paid.
Yeah, they won't get paid.
You can have a $500 operation and Medicare pays the doc $40.
Right.
So
See,
this won't affect people who are, say, you're middle-aged, you're employed, or your husband, your spouse is employed, and you're on their insurance plan, and it's business as usual for you.
It will, except premiums are going up.
Okay.
You got to pay for 42 million people. The other issue that people tend to forget about that we appreciate on the medical side is you add 42 million people to the insurance rolls, you didn't add the appropriate number of healthcare providers to take care of 42 million
because they're dropping out of business.
And in fact, 60% of doctors are going to be retiring early just because they're scared of change too.
That's
so
right.
Let me ask you this, and this is just plain devil's advocate on the other side of the argument. If you have this many more people who are now being provided insurance, they're now being provided care from physicians, if they have disease, if they have an illness, the idea is they'll be healthy. In the long run, if you have that many more people theoretically being healthy, in the long run, isn't that better for all of us? Because wouldn't theoretically rates eventually go down if we have a healthy population?
Well, The first point is absolutely true. Yes, I think the point, what we want to do at the societal level is increase everybody's health, but it costs money.
Right.
And how I got very interested in this, I'm a preventative cardiologist. My interest is how do we identify heart disease early and take care of it so you never need stents and balloons and surgery and have heart attacks and all that stuff. So that's kind of my focus, and that's really the focus. A lot of the focus behind the Affordable Care Act is preventative medicine.
And the thing that baffles me is that if you're uninsured in this country, you can still go to the county hospital and get medical treatment. But what's happened with Obamacare, it's given them that could already get free treatment, it's giving them now health care, but it's taken away from the older population. And I'm telling you, it's going to be a nightmare, because guess who's going to take care of the older population? You, that's who's going to do it.
But the flip side to that, the positive side, is if this generation is taking care of the older generation is getting cut, but this generation is getting more health care. So this generation theoretically will be healthier to care for an aging population that's lost their health care.
Well, I'd like to know if you have read the 15,000 pages and can come up with that same answer.
I'm just making the argument that people.
The Obama, you're making the Obama argument.
I'm making the other side of your argument, so yes. But I think that politicians try to put things into place theoretically for the overall good of the population. And I don't think that there's any exception with Obamacare.
Sure, I think the concept is good. The question is, we're doing this tremendous experiment. We've never done it before, but it's an experiment.
Right.
We're going to see how it turns out.
And we're not taking it in stages. That's the thing that bothers me. It's all one big pill that we're all going to have to swallow.
Come October 1st.
And I thought now they've put this off for a year. Is that a scam?
There's two stages of implementation. The first stage is the individual mandate. So that's saying if what happens is that you have to have insurance. If you don't have insurance, you're unemployed, or you're provided, or you don't have insurance provided to you, that you have to get insurance. If you don't get insurance, you're going to pay an additional $95 on your taxes.
And do you know how many people don't have jobs anymore? How many people?
That becomes $695 because we got to pay for this system.
And there are people out there that have lost their jobs. I mean, we're in a terrible state over money right now.
And then you're going to have to then go into these exchanges and get your health care there.
That's right.
But we don't even know how much it will cost for you to get your health care.
If you've got something to say about this.
How about everybody just get smart about nutrition and health, and we become a healthy society, and nobody ever needs to use their insurance? How about that?
That's right.
If you've got something to say about this conversation and you haven't said enough, share your views on our Facebook page. Just go to facebook.com/D the broadcast and weigh in. Or better than that, start talking to your congressman.